frontliners, a health expert says receiving Sinovac shots is better than nothing. In an interview here on One News Now, Dr. Maricar Limpin of the Health Professional Alliance Against COVID-19 explained that despite the 50% general efficacy of Sinovac vaccines, it can still effectively prevent severe COVID-19 infections. Limpin also noted that confidence of the Sinovac shots is quite high on healthcare workers. This comes as more than 500,000 Sinovac COVID-19 vaccines are set to arrive in the country today.
The study will show that it may not be the best vaccine for healthcare workers, considering the risk that healthcare workers are placed with. 50% might not be enough. But if you're not at very high risk, then the 50% will be enough compared to zero protection.
After the arrival of Sinovac and AstraZeneca vaccines, 20 million Moderna doses are also set to be shipped to the country soon. That's according to Foreign Affairs Secretary Teddy Boy Locsin Jr. He says they will finalize the timeline soon and urge the public to continue observing proper health protocols in the meantime. Moderna vaccine uses mRNA technology and boasts a high efficacy rate of 94%. It is given in 2 doses, 20 days apart, and company data suggests that it starts offering protection against COVID at 2-week mark. It can also be stored in a normal freezer with standard temperature of 20 degrees Celsius for up to 6 months. Now, a local vaccine-focused pharmaceutical firm is eyeing to establish the first COVID-19 vaccine plant in the country. Clovax Biotech is currently in talks with the DTI and Bureau of Investments for the vaccine plant construction. The company aims to develop the next generation COVID vaccine in partnership with WHO pre-qualified vaccine manufacturers from Korea, namely U Biologics and LG Chem. U Biologics Eurovac or UCORVAC 19 in particular is currently approved for human clinical trials. Clovax founder and CEO Giovanni Aligog says Clovax and U Biologics are in process of applying for the emergency use authorization. National Policy Against COVID-19 Chief Implementer and Vaccine Czar, Secretary Carlito Galvez Jr. endorsed Clovax Biotech to the DOST. The plant would cost around 7 billion pesos to construct and would be capable of providing 40 million doses for domestic use if the government chooses to procure them. Clovax has been distributing various vaccines since 2003. Now, the Makati City government is encouraging residents to sign up to receive the Sinovac COVID-19 vaccine. The city government says interested residents may register at sinovac.safemakati.com. Residents would have to answer a questionnaire that would determine if they are fit to receive the Sinovac vaccine. The Makati LGU previously secured 1 million doses of AstraZeneca through a tripartite agreement with a pharmaceutical firm and the national government. This is part of the city's allotment of 1 billion pesos to buy COVID-19 vaccines. Now, some 400,000 tourism industry workers who were displaced by the COVID-19 pandemic may still avail of the one-time cash assistance from the Labor Department. DOLE Assistant Secretary Dominic Tutay said workers may still apply for the COVID-19 assistance under the agency's Adjustment Measures Program for tourism workers. Tutay noted that only about 171,000 tourism workers have availed of the program. She said that DOLE is, quote, still open for application for workers in the tourism sector of more or less 400,000 potential beneficiaries. Bohol Province will continue to require negative RT-PCR test results for travelers who want to visit. That's according to Bohol Governor Arthur Yap. This after the IATF pronouncement that COVID-19 testing for travelers is no longer mandatory unless the LGU of destination requires it. Bohol, with a population of around 1.5 million, has logged a total over 1,000 cases since the pandemic started. Now, to further discuss the provincial government's plan for tourism in Bohol, we have with us this morning Governor Arthur Yap. Governor, good morning.
Lisa, good morning. I hope you can speak up. You're really coming in very, very faintly here.
Yes, Gov, we'll do our best. First question, Gov, can you please give us an update on the COVID situation there in Bohol?
I'm happy to report that at least the situation is managed. On March 16, we are going to mark 1 year of being under COVID-19 since we locked down March 16 of 2020. In that time, we registered about 1,000, just a little over 1,000 infected local Bolanons. And the recovery rate has been so far at more than 90%. And we've had deaths as well, but these affected people who were senior citizens with already comorbidities. So that's around 22 deaths. So in an island province of 1.5 million people for a year, the statistics for us are about just a little over 1,000 people who have been infected, 90+% recovery, and just 20 deaths.
Those are good numbers. Gov, what are you not amenable to waiving the negative test result requirements for travelers?
Lisa, yes?
Gov, I'll repeat again, we understand that you are not in favor of waiving the negative test result that would be a requirement for travelers entering Bohol.
Yes, we are not. We are not in favor of that. In fact, moving forward in this new normal, it is always a play on balance, balancing the interests outside the Bohol and balancing the interest inside Bohol. We would like a return of our tourists and visitors and businessmen who come to Bohol to do business. But of course, we have to balance that with the concern of the local residents who want to preserve the numbers we have right now. So, trying to at least walk on the middle of these two interests and trying to balance these two interests, we are not inclined to waiving the tests because it is as much an issue of inviting people confidently to come into Bohol, and it is also as much as the people locally being confident enough to receive visitors again and businessmen again. So trying to walk the thin line, the middle ground, is at least still imposing the tests. So at this point in time, for returning residents, LSIs, OFWs, APORs, or tourists, we are asking them to take either an RT-PCR test or an antigen test. If it's an RT-PCR test, it should have a 72-hour validity from travel. And when they arrive, they have 3 days of validity before they're asked to take another test again. If for those who are coming, who would opt for an antigen test, they have a 5-day validity where they will be asked to take another test again. But when they come in, they will no longer be quarantined. So that's the middle ground. They have a test, they come in, no quarantine. But if they want to stay longer than 3 days and their test was RT-PCR, they'd have to take a second RT-PCR test here in Bohol. And we have an RT-PCR lab that will do that for them. For antigen, the validity is 5 days.
Gov, as you mentioned, these tests are requirement. The negative, of course, RT-PCR test or antigen test. But other than those, what are the required requirements for travelers coming into the region?
Yes, those are the requirements, basically, and that you do not have symptoms at the time when you embark on your travel.
Gov, who are allowed to travel to Bohol for leisure?
Risa, I'm really sorry. There's a strong rain at this point in time here in Bohol. But let me just explain something. No, maybe the question is, if you don't have an RT-PCR or an antigen test, are you going to be allowed into Bohol? You will be allowed into Bohol, but you will have to take an RT-PCR or an antigen test here in Bohol upon arrival. And that is the time when you are required to be isolated or quarantined. Quarantine means in a government facility or in your own home, or in certain designated hotels if you're a tourist. So it does not mean that when you arrive without a test, you will not be accepted. If you do not have any of the COVID symptoms, you will be accepted, but you will be required to isolate and quarantine yourself as you await the results of your test. So we advise tourists and visitors to take a swab or a saliva test or an antigen test from wherever they're coming from. For domestic tourists, that would be Manila. And I guess for international travelers who are transiting through Manila or Cebu, you must take the test in Manila or Cebu. When you come into Bohol, we will assume that you have taken those two tests, and we feel it's very convenient anyway at this point in time. The swab test or the saliva test. I personally did the saliva test with the Philippine National Red Cross, and it just took me 15 minutes and I was in the car. So we feel that at this point in time, these tests are not a very burdensome imposition on visitors and businessmen who are coming to Bohol.
Governor, thank you very much for your time. That was Governor Arthur Yap of Bohol. And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. Here are the world's biggest stories. Auckland, New Zealand has been placed under their second lockdown in a month after the emergence of the COVID-19 UK variant in the area. This new lockdown only allows people to leave their homes for essential shopping and essential work. Public venues will also remain closed. Quebec cinemas are now allowed to reopen along with indoor skating rinks and pools. But before you fly to Canada for a taste of that whole movie watching experience, keep in mind that you won't be able to enjoy your usual popcorn tub. Movie theaters are not allowed to sell food and drinks, a move that upset some cinema operators. In addition, cinemas will also have to reduce their capacities. The government says this gradual reopening of certain businesses is to give families more options in entertaining their children. And the United States House of Representatives passed a $1.9 trillion coronavirus relief package. The American Rescue Plan would pay for vaccines and medical supplies and send a new round of emergency financial to households, small businesses, and state and local governments. The bill's big-ticket items include $1,400 in direct payments to individuals, a $400 per week federal unemployment benefit, and help for those in difficulty paying rents and home mortgages during the pandemic. Now, meanwhile, the U.S. has also authorized Johnson & Johnson's single-dose COVID-19 vaccine, setting up for additional vaccines in the country. The U.S. government, which purchased 100 million doses of the J&J vaccine, plans to distribute about 3 million to 4 million doses this week. And in sports, the Philippines will have another shot in qualifying for the 2021 Olympic basketball tournament. This after FIBA announced that they will be replacing New Zealand, who withdrew from the competition. Gilas Pilipinas was selected after being the best-ranked team from the Asia-Oceania region after New Zealand, which pulled out of the qualifiers, citing high cost of sending teams abroad. Gilas will now be competing at the Olympic qualifying tournament to be held in Serbia from June 29 to July 4. The Samahang Basketball ng Pilipinas welcomed the decision of FIBA to allow the team to fight for a spot in the Olympics. In a statement, SBP President Al Panilio said the federation is hoping that center Ange Kwame will have been naturalized once the tournament tips off. And those are the top stories of the hour. Join us later again at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.